So when we're talking about secondary respiration, we're talking about the motion that occurs from the movement of the diaphragm. Now, in the pediatric practice, this occurs 30 to 80 times per minute. So it's not harder to manage, but it's harder to use it as an adjusting protocol because the child's cranium is literally expanding, contracting 30 to 80 times a minute. But if we slow the process down, what we're looking for and what we want to feel is this motion. On inhalation, the system goes into flexion. On exhalation, extension. So when a system goes into flexion, one of the things that's going to happen is the sphenobasilar angle is going to get smaller. That angle getting smaller is what we call flexion. You can see here as the child breathes in, this is inhalation, exhalation, inhalation, exhalation. A lot of things happen. The greater wing, the sphenoid will shift. The pterygoid process right here shifts posterior superior. Then the palate will rise up. You can see as the palate comes up, we're going to get an inhalation, exhalation. We see that the occiput and the frontal approximate each other. That's why when we say cranium inflection, the A to P is shorter and the lateral aspect is broader because the temporal bones, which we're going to see in a second, will flare out, flare externally rotate. So this is that motion that you're feeling during inhalation and exhalation. We look at it this way from a front view. This is what we're talking about, expansion. You see up here the sagittal suture as it spreads out. This is inhalation, exhalation, inhalation, exhalation. You could see here the basilar portion of the, squamosal portion of the occiput approximates the frontal. The temporal bones flare out. So if I'm just holding a cranium as a child is breathing in and out, I should be able to feel, especially laterally, this slight expansion and contraction during respiration. If I have a problem with that, that's why we talk about doing the dorsi and plantar flexion, because that will stimulate tension in the dural meningeal system, and it will mimic this flexion and extension motion that occurs during respiration. In the pediatric cranium, let's just take a look at this as a whole. So the pediatric cranium, because the bones are membranous in nature, the entire cranium will expand and contract as we move through this process. And you can see here, the other thing that we also notice, and why we talk about the dural system here, is if you look down here at the foramen magnum, in this membranous portion of the cranium, especially right here where we're talking about the occipital bone and the temporal bones, you can actually see the foramen magnum expand and contract. And remember, there's a very strong dural attachment that occurs here. So as the dura attaches into the foramen magnum, it comes up into the cranium and forms the falx cerebri and the tentorium cerebelli. But again, look up here, look at the sutural system here. You can see the expansion and contraction. Again, this is inhalation, exhalation, inhalation, and exhalation. So when you're starting to put your hands on craniums, whether it be babies or adults, is just to feel the changes in expansion and contraction as the patient is breathing in, especially when you work with an adult or an older child. You can have them control that respiratory cycle, and it'll help you kind of key into being able to feel the motion.